Today we are going to talk about prenatal diagnosis and testing. Prenatal testing is used to identify women at risk of having a child with genetic disorders. So in order to prevent genetic disorders, we are conducting prenatal tests. Prenatal tests include three components: prenatal screening, prenatal diagnosis, pre-implantation diagnosis. Remember the three components: prenatal screening, prenatal diagnosis, pre-implantation diagnosis. We have to know when to perform a prenatal test. Those are called indications. What are the indications of prenatal testing? The first indication is women at advanced childbearing age, that is more than 35 years of age at her first pregnancy, and father above 40 years. Women inheriting serious genetic disorders such as chromosomal translocations, congenital abnormalities, and women are at high risk of transmitting the disease to the fetus. Under these conditions also, we should advise women to undergo for prenatal testing. Women are couple exposed to mutagens or radiations. Because mutagens or radiations may lead to some type of cancers and fetal anomalies. Some ethnic indications are also there, like Tay-Sachs disease is common in Jews. Thalassemia cases are more prominent in European population. So in Jews, you have to rule out Tay-Sachs disease. For that, you have to advise a Jewish woman to undergo prenatal test. There are some points which are to be considered before performing a prenatal test. Like there are some important ethical guidelines which have been established, which a healthcare provider has to consider before offering a prenatal testing. So you have to take care of ethical issues also. All the healthcare providers should be aware of clinical indication and identifying if it is present in the patient. Okay, without any clinical indication, no patient should be sent for prenatal testing. You have to clearly discuss the potential complication of genetic disorders in question with the patient. So what are the potential complications of genetic disorders? Like Down's baby will have mental retardation. That should be explained to the mother and her family. We have to inform the patient about risks and benefits of prenatal testing. If appropriate indications are present in the pregnancy. If any, like we have seen indications, right? Woman above 35 years, father above 40 years, any chromosomal anomalies. Okay, all these. If any indication is present in the pregnancy, current pregnancy, we have to explain to mother about the risks and benefits of undergoing a prenatal test. What are the types of prenatal testing? We have invasive tests and non-invasive tests. Under invasive tests, we have amniocentesis, chorionic villus sampling, cordocentesis, and placental biopsy. Under non-invasive techniques, we have ultrasonography, MRI, maternal serum testing. As you all know, all pregnant women go for ultrasonography because it's a most common non-invasive prenatal test. Okay. It is cheap and it can accurately tell the gestational age. It can also detect ectopic pregnancy or non-viable pregnancy. We can also assess fetal growth. We can detect fetal anomalies. We can also detect any twin pregnancies. And we will be knowing the position of placenta. We can also know the amniotic fluid volume, whether it is less or more. Okay, all these are all the advantages of the ultrasonography. It is the most common non-invasive prenatal test which almost all pregnant women will undergo. Okay. Maternal serum testing is also a non-invasive prenatal test. Mainly we will be looking for three markers: human chorionic gonadotrophin hormone, alpha fetoprotein, estrogen and estriol levels. HCG levels are raised in pregnancy. If any deviation from the normal levels or normal range should be looked for. If HCG levels are more, then you can suspect hydatidform mole. If the levels are very low or very slowly raising, then you can suspect ectopic pregnancy. Alpha fetoprotein levels, if they are more in the maternal circulation, then you may suspect Down syndrome. Estrogen and estriol levels are normally high in pregnancy. If any decrease in the estrogen and estriol levels, you have to suspect any placental or fetal anomaly or diseases. We have finished non-invasive techniques, that is ultrasonography and maternal serum testing. Now let us see what are the invasive techniques. Remember amniocentesis, chorionic villus sampling, cordocentesis and placental biopsy. We will see one by one. The first and most common invasive prenatal test is amniocentesis. It is most widely used invasive procedure which can be performed around 15 to 16 weeks of gestation. Why we do amniocentesis? Because amniotic fluid contains fetal cells. Fetal cells are the good source for detecting fetal abnormalities like neural tube defects, Down syndrome and 21-hydroxylase deficiencies. Okay, amniocentesis means amniotic fluid collection in simple terms. Okay. In amniotic fluid, we will have fetal cells which are good source for detecting any fetal abnormalities like neural tube defects, Down syndrome and 21-hydroxylase deficiency. Let us see the indications for amniocentesis. Advanced maternal age, any history of child with chromosomal abnormalities, abnormal maternal serum markers and ultrasound findings, chromosomal rearrangements in parents, detection of intrauterine infection, metabolic disorders, determination of AFP and acetylcholinesterase levels. Okay, these are all the indications of amniocentesis. This is a schematic representation just to tell you how they perform amniocentesis. First thing you have to remember that it should be done always under an expert's advice or expert's observation. Okay. And you should always have some ultrasound monitor. We have to use 20 to 22 gauge needle. First you have to locate the placenta. You have to identify the fetal pole. Then slowly enter the amnion and first you will be collecting 2 to 3 ml of amniotic fluid which should be discarded because you may be piercing maternal tissues here, so there will be contamination with the maternal cells. So you have to discard first 2 to 3 ml, then remaining fluid you can send for your analysis. The next invasive prenatal test is chorionic villus sampling. You have to know what is chorionic villi. See here some villi, finger-like structures. These are villi. These villi will have some epithelium. Okay, that epithelial cells will be collected in this procedure. So as for amniocentesis, you should have some expert to perform this test and you should have ultrasound monitoring. You can go from two routes. You can go along with the cervix or you can go through the abdomen. So trans-abdominal or trans-cervical route. Okay, in any ways you can collect the sample. After collecting the epithelial cells from chorionic villi, you can send the sample for biochemical studies and chromosomal analysis. You have to know what are the indications for chorionic villus sampling before advising chorionic villus sampling for the patient. Almost the indications are same for amniocentesis and chorionic villus sampling. The main difference is that chorionic villus sampling is performed around 10 to 12 weeks of gestation, whereas amniocentesis is performed around 15 to 16 weeks of gestation. Okay, so there are more chances of fetal loss in chorionic villus sampling. So it is mainly done around 10 to 12 weeks of gestation in order to identify single gene disorders like Fragile X syndrome, hemophilia A and B, hemoglobinopathies, thalassemia, Zellweger syndrome, Tay-Sachs disease, cystic fibrosis, phenylketonuria. There are many other indications for chorionic villus sampling. You can easily remember hemophilia A and B, hemoglobinopathies, thalassemia. Okay. So if you know all these, you can also remember some storage disorders like Tay-Sachs disease, cystic fibrosis. Okay. Let us see what is cordocentesis. As the name suggests, cord. We are collecting sample from umbilical cord. Okay, we can collect sample from umbilical cord or umbilical vein, but not from umbilical artery because the risk of bleeding is more with umbilical artery. Okay, first you have to identify the placenta. Try to identify umbilical cord because you are going to collect sample from umbilical cord only. Cordocentesis is otherwise called fetal blood sampling. So you are collecting fetal blood here to identify any fetal hemorrhagic disorders or the condition of fetal blood like any thrombocytopenia, anemia, fetal infections, etc. So that's why it is called fetal blood sampling or cordocentesis. Again, there are some indications for cordocentesis like fetal hemorrhagic disorders, sickle cell anemia, thalassemia, etc. Fetal infections like toxoplasma, rubella, syphilis, etc. Fetal acid-base balance is very important in cases of severe growth restriction. Okay, to terminate the pregnancy, you will correlate acid-base balance, okay, with the growth of the fetus. Karyotyping is also another indication for cordocentesis. Suspected fetal thrombocytopenia, twin transfusion syndrome, fetal thyroid disorders. In all these conditions, you go for cordocentesis. There are other indications also like suspected fetal anemia, omphalocele, abnormal Doppler flow, duodenal atresia, single umbilical artery. So it's easy to remember some fetal causes like direct fetal causes: fetal anemia, fetal thrombocytopenia, fetal hemorrhagic disorders, fetal infections. Okay, remember at least 4 indications for this condition. The last invasive prenatal investigation is placental biopsy, where you are directly taking sample from placenta. If you are not able to perform cordocentesis or amniocentesis due to any cause, you can go for placental biopsy. This is mainly done whenever there is major abnormality in the ultrasound or any abnormal maternal serum testing values. So to confirm, you can go for placental biopsy. You can send the sample for molecular or cytogenetic analysis. Thank you for your attention. At least remember the names of the techniques. Invasive techniques are amniocentesis, cordocentesis. Cordocentesis is otherwise called fetal blood sampling, chorionic villus sampling, okay, placental biopsy. Non-invasive techniques are ultrasonography, MRI, and maternal serum testing.